All right, today we're diving into a condition that affects millions, congestive heart failure. But to really understand it, you kind of have to forget the idea of the heart as just one single organ. Instead, I want you to think of it as a tale of two very distinct, very hardworking pumps. Think about it this way. Your entire circulatory system is like this massive highway system, and your blood cells are the cars. And right at the center of it all, the heart. It's the main interchange that keeps all that traffic flowing smoothly. So what happens when that central interchange gets completely clogged up? Well, that, right there, is the essence of heart failure, a massive, body-wide traffic jam.
And this diagram shows us exactly what we're talking about with that two-pump system. See on the right, in blue, that's pump number 1. It takes in all the used blood from the body and sends it on a quick trip over to the lungs to get a fresh shot of oxygen. Then, over on the left, in red, you've got the second pump. This one's more powerful. It takes all that fresh, oxygenated blood and pushes it out to your entire body. Two totally different jobs, two completely different journeys.
Okay, so keeping that two-pump system in mind, what do we actually mean when we say heart failure? I know it's a term that sounds really final, almost scary, but the reality is a little more complicated than that. The most important word in that whole definition is impairs. Heart failure does not mean the heart has stopped working. Not at all. It just means that one or maybe both of these pumps has gotten inefficient. It's having a hard time either filling up with blood properly or squeezing that blood back out with enough force. And that's what kicks off the traffic jam we were just talking about. Now, this inefficiency really comes in two main flavors. You've got systolic dysfunction, which is basically a squeezing problem. You can think of it like a weak muscle that just can't contract the way it's supposed to. Then you've got diastolic dysfunction, and that's a relaxing problem. Here, the muscle is too stiff, so it can't relax and fill up with blood properly between beats. But you know what? Whether it's a problem with squeezing or relaxing, the result is the same. Traffic starts backing up. So you have to wonder, what could possibly cause these incredibly powerful pumps to start losing their edge? Well, it turns out a whole variety of diseases and lifestyle factors can put a serious strain on the heart muscle over a long period of time. By far, the most common culprit is something called ischemic heart disease. That's a fancy way of saying that the arteries that supply the heart muscle with its own blood get blocked. That essentially starves the muscle of oxygen. But other things can do it too, like faulty heart valves, diseases of the heart muscle itself, called cardiomyopathies, or even toxins that directly damage the pump's machinery. And the factors that increase your risk? Well, they fall into a couple of different buckets. Some of them are things we just can't change, right? Like our age or our family history. But a whole lot of them are tied to medical conditions we might already have, like high blood pressure and diabetes, or to lifestyle choices, like smoking or not getting enough exercise. The bottom line is, all of these things put a ton of long-term stress on the entire system. Okay, now let's get into the nitty-gritty of what actually happens when one of these specific pumps starts to fail. We're going to start with the powerhouse, the left pump, the one that sends blood out to the whole body. So just think logically for a second. If the left side can't pump blood out to the body fast enough, where's that blood going to go? It has to go somewhere. It backs up. And the place it just came from is the lungs. This creates that traffic jam, what doctors call pulmonary congestion. And all of a sudden, pressure starts to build up in the lungs' very delicate blood vessels. And here is what that looks like. A healthy chest X-ray should be mostly dark, right? Because it's showing air-filled lungs. But look at this. All of that hazy white stuff, that's fluid. It's literally been pushed out of the blood vessels and is now filling up the air spaces. This is called pulmonary edema, and it's basically a flood happening inside the lungs, which, as you can imagine, explains why a major symptom is severe shortness of breath. Now let's zoom in, way in, from that X-ray to the microscopic level. What you're looking at here are the tiny little air sacs in the lungs, called alveoli. Normally these should be totally clear, just full of air. But here, they're filled with this pinkish fluid. That's the same fluid we saw in the X-ray, and it is physically blocking oxygen from being able to get into the bloodstream.
The pressure can get so intense that it even forces red blood cells to leak out into those air sacs. So the body's cleanup crew, these cells called macrophages, they rush in to try and get rid of them. But as they digest these red cells, they get loaded up with old iron pigment, which creates these really distinctive brown speckled cells. They are so unique to this condition that they've actually been nicknamed heart failure cells.
Okay, so let's shift gears and go to the other pump. What happens when the right side of the heart, the one that's supposed to be pumping blood to the lungs, starts to fail?
Well, the principle is exactly the same, it's just happening in a different place. If the right pump can't effectively push blood into the lungs, that traffic jam just backs up into the veins of the entire body. And this is what's known as systemic congestion.
Now, this body-wide congestion has a really dramatic effect on certain organs, especially the liver. All that backed up blood starts to pool in certain areas of the liver, creating these darker, reddish spots, while the paler areas are the ones that are less congested. This mottled look is so similar to the spice nutmeg that it's actually called a nutmeg liver, and it's a classic sign of right-sided heart failure.
And this systemic backup, you can see signs of it all over the body. The veins in the neck start to bulge out, fluid leaks into the legs and the abdomen causing swelling, the liver and spleen get enlarged and tender. Even the gut gets congested, which can make you lose your appetite.
So, to put it all together, we really have two different stories here. Left-sided failure is a story that's all about the lungs, and it causes symptoms like shortness of breath. Right-sided failure is a story about the rest of the body, and it leads to things like swelling and organ congestion. Of course, in the real world, since failure on one side often puts strain on the other, patients can eventually end up with symptoms from both.
Now we get to the final and maybe the most crucial part of this whole story. Your body is smart. It knows something is wrong when these pumps start to weaken, so it sounds an alarm. But here's the twist. Sometimes the emergency response can actually make things a whole lot worse.
When the body senses that blood flow is getting low, it pretty much panics and pulls 3 different alarm levers. First, it triggers your fight or flight response, which makes the heart beat faster and harder. Second, it flips on a powerful hormonal system that tells the kidneys to hang on to salt and water, trying to increase the amount of blood in the system. And finally, it releases yet another hormone that makes the body retain even more water. And here is the crucial, ironic twist. These responses are absolutely brilliant for a short-term emergency, like if you're losing blood, but in chronic heart failure, they create a terrible, vicious cycle. You're telling a heart that's already exhausted to work even harder, and then you're loading it up with a ton of extra fluid that it has to pump. It's like flooring the accelerator when your engine is already overheating. It just makes the problem so much worse.
And that really is the big takeaway. The story of heart failure isn't just a story about the heart. It's a cascading failure, a domino effect that shows you just how deeply interconnected our heart, our lungs, our kidneys, and our hormones really are. When one critical piece of the system starts to weaken, the whole system scrambles to try and fix it, and in doing so, sometimes makes things worse. It really makes you wonder, doesn't it? What other hidden connections are working tirelessly right now just to keep all of us in balance?